وفاقی وزیر صحت سید مصطفی کمال کی زیر صدارت نیشنل EPI اجلاس جاری ہے، جس میں تمام صوبوں اور عالمی شراکت دار بھی شریک ہیں۔ سید مصطفی کمال اجلاس سے براہ راست خطاب کر رہے ہیں۔
Now let's concentrate and let's have a little bit light on the real happening in Pakistan. What are the issues? What are the challenges? See, we all are here. We gather here to think and plan and execute for 240 million people who are living here in this country, to how to save their life, their children's life, how to make them not to fall sick, not to come to the hospitals. We are here, we all are gathered here to plan and execute those resources which all of us, partners and government of Pakistan and provincial government, all are putting together to save people's life, to serve people, to serve mankind without any differences of caste, creed, religion, beyond all any affiliation. But on the other hand, we must stop ourselves, we must take a breath and just ponder upon the situation of recipient. How people in whom we are gathered here on this forum, how are they reacting to our activities? How they are perceiving it to our activities? And it's bad, sorry affair, but we must accept the realities within open eyes, and those realities are cruel, and those realities are that people of this nation, the common man, has not taken all our exercises as serious as it should have been, as supportive as it should have been. The essence of this whole campaign has not been understood well. There's something somewhere, something is wrong. We are going at the doorstep of the people of Pakistan, and yet they're to save their children's life, yet they're shutting off the door on our faces. So something somewhere is wrong. We must address, we must stop ourselves. To me, we can't just, running haywire without any stereotype of attitude, because the predecessor was doing it, so I have to do the same thing. Let's not judge ourselves by our activities. Let's judge ourselves by the results. Judge ourselves by the results which we are getting, by the response we are getting. And that is where we should take a breath, hold down a bit, take a pause, and relax and review what's wrong. I'm taking a medicine, I'm giving a free vaccine. The government is giving a free vaccine to save a life or to a human being, and yet mother of that child or father of that child is refusing it. How could that happen? So we must address this issue first. We must not just take all the stuff without clearing without talking to their mind and their heart, without creating a space of our good deeds into the hearts and minds of the people of Pakistan. We must not go to their doorstep. We must offer them. We first address this issue first. So to me, this is the prime thing. That's why, see, human being, you all are the experts and doctors. I'm the least educated person in this regard in this room. I consider myself. I'm not a doctor, but I have been dealing with human being and for last more than 3 decades. This creature of God can surprise you anytime. You have to deal with the minds of that human being. Unless and until we have that, sorry to say, allow me to be very candid, our progress, all these funding and this program will not be a successful program. Right now, no matter how good we talk about ourselves, the ground realities there are deficiencies, there are problems, there are gaps in the process of immunization. And why I'm so concerned about this whole thing, to me, look, I was there in some international forum just a couple of days back, and I was talking the same thing. For me as a politician, it's a very sexy thing to have the picture in the newspaper every day, and that picture of newspaper and the media will not come when I'm talking about the prevention in a closed door room and talking about and doing something about the prevention. The picture will only come if I'll have a small 4 rooms dispensary inaugurating somewhere, cutting a ribbon there. That's where the picture will come to all over the, and that's what the politicians' needs and requirements are. On the contrary, I'm taking another way. I'm least bothered about these opening a new hospitals. Yes, it might be and must be necessary, but not to my pleasure, not to my interest. Because how many hospitals in this country you will open? If today 11,000 mothers are dying in pregnancy, can you think about anywhere in the world? There's no comparison. Pregnancy is not a disease. Saying 11,000 word is easier thing, Just start counting 11,000 bodies. Nobody will be able to count it. 11,000 mothers are dying every year in pregnancy. 43% stunted growth is there. Children, all the cancers, hospitals are full of pediatrics. kids cancer wards are full of kids, small like a flower, and they are carrying cancers. 8,000 cancer is just coming in one category. Just yesterday we signed that WHO and UNICEF and others. 8,000 children are getting cancer, and out of 10 patient kids, 7 are dying. So this is the scenario. And we about, prevention is better than cure. 68% diseases are waterborne diseases. We are not treating our sewage right from Gilgit till Karachi. Sewage is contaminating with somehow the other with someone's water. So if we are not cognizant about these prevention, sorry to say, I'm least interested, talking about the healthcare system of Pakistan. Then healthcare doesn't work within the boundaries of the hospitals. Means healthcare mechanism starts out of the gate of the hospital, the street, the neighborhood, to each and every corners of this country. Healthcare means not allowing and enabling people not to fall sick. It's not that allowing people, entire environment is creating the sick people, and then we are waiting for them at the hospital. Come and will receive you there. So this is what we are doing. So it's a sick care. It's not an health care. Right now, Pakistan system is the sick care system of Pakistan. It's not the health care system of Pakistan. We have to convert this from sick care to the health care system of Pakistan, and that's where this whole thing, what we are sitting today, what you all are sitting today, to review how to allow and enable our communities, our people, a common man, a common kid, to use these preventive measures, which are the vaccines, and save themselves from all many diseases which we are offering to them right now. But the recipient of these help, they have a mistrust somehow. There's some communication, lack of communication, some communication gap. He or she should be, the community, the entire country's population should be so thankful to us, so grateful to us. They should be looking for us. Rather, we are going to their doorstep and they're shutting off their door on our faces. We are taking life to their doorsteps and they're shutting off their door on us, on our faces. Something somewhere is wrong. We must address. Take a breath. Hold on a bit. Don't keep on running, and address this issue first. Face this challenge first. Confront this challenge first, and then move forward. This is a software. You have to change the software of the people of Pakistan first, and then you take these services. Otherwise, it's counterproductive. I can't imagine. It kills me when I think of that. How could people think negative about you when you're taking life to the people, to their next generation? What's wrong in it? How the misconceptions in their mind are like, sometimes you tend to think of that, are you so bad, that bad? What they're thinking about you? We all are, you all are left your homes, your country from different parts. You travel all the way, sitting here, you left your provinces, travel all the way, sitting here, and someone just enter in this room and say, hey, look, you guys are the agent. You people have gathered here to kill my children, my upcoming generation. How would you feel how would you feel it? You all are sitting here to destroy my upcoming generation? That's why we are sitting here. Are we the agents of someone and planning here, God forbid, to destroy our own upcoming generation, our own kids? For God's sake, that's the reality. We must address this. Something somewhere. And this whole thing lies on us. We have made mistakes. It's not nobody else. We must have made some mistakes. And we just keep on, putting the dust under the carpet and just moving forward. I'm least bothered by judging ourselves by the activities. That we have done this much, that much, this campaign, that. What are the results? What did we get out of this whole activities? Please tell me that actually. I'm interested in that actually. I would be interested in that. At the end of the day, what are the results? If we have just exhaust ourselves by many activities, at the end of the day, the numbers of kids falling sick is not coming less. My hospitals, which has been overflooded, if that flood is not reducing, if the patients' number are not reducing, if children's peds, wards, beds are not getting empty, so that means something somewhere is wrong. So sorry to take it to talk in these manner. I'm so sorry for that. I don't know whether you like it or not, but I'm sorry for that. What can I say? I'm not here to please anyone or myself and to deceive myself and to the nation or whatever. I see this is the problem. We all have to fix it, and I want you all to understand, argue, and then agree, and then fix it, and then move forward. And don't have a futile effort. Don't put yourself in a blind alley. He said, don't put yourself in a dead end. So this is what I would emphasize more. I know the communication strategy among the partners is with UNICEF. So we had a very detailed meeting. I'm going to have it again in a day or two. They took me a few days. They asked me they're going to come again. And that's where we see the communication strategy of this whole immunization campaign, including everything. What is how? It should not be the case that we have to give an advertisement advertisement in the newspaper, so our responsibility is over. We are not thinking particular newspaper, let's say it's English newspaper, prominent newspaper, and you are giving ad in that newspaper for family planning. People who read these newspapers, they already have the family planning. Those who could understand English and read English, and those who could read that X newspaper. So those who are having 12 children at their home, they don't understand English. They don't even know the name of that newspaper. So this message has not gone to them. Don't take me wrong. I'm not casting blame on anyone. All I'm asking that we must not just running, stereotype, without seeing that where are we running for? What is the destination? Where are we heading? I want each and every day we spend each and every hour, you people, all this August gathering, you're the important people for your family, for your community, for your organization. These many hours which you spend, these efforts you are spending there has to have some inner satisfaction inside your heart that yes, our contribution is making some difference. We are making some differences. Very sorry to say today, this feeling doesn't come to my heart. I'm not been able to convince myself. Yes, we are doing many things, but we know we can do. How could this thought, this question, this feeling, this really shatters me. How could someone think ill about us when we are taking life to their doorstep? How could you do that in your own country? Something somewhere is wrong. We must fix this fast. We must talk to them. We must talk in any manner which is required, which is available. We come out of box solution. So the communication is must, and I'm requesting very humbly, very submissively to my friends who have come to the provincial authorities as well. We must not leave even a single stone unturned to find out the medium, the influencer, to those of every street of Pakistan who could influence that house to talk to that house and could communicate this right thing in a right manner of all these activities. I have got no longer agenda. See, there should have been a case where people are looking for the vaccines are not available. Vaccines are available. Vaccines are even, let's say, God forbid, if some of our health workers or people in our primary healthcare units and all, if they are, God forbid, if they are making a wrong statements, fudging the records, God forbid, why would they do that if somebody just throwing the vaccine somewhere and reporting it that those vaccines have been utilized? God forbid. Why would they do that? If people are hungry to take that, why would they throw it? Why would at the same place? Because there is the stigma, right? That there will be refusals. They can't report that those many refusals. The question will come on them. So better not to report that refusals, not to report those things and then get away from that. If people weren't so desperate to put these vaccination to their kids, these people will be running after us that we have got less supply. Please give us more supply. But that's not the case. So very humbly I would submit, I would request this August gathering, please discuss this communication ways and means according to the ground realities of Pakistan, not according to some developed country, some developing country, some other. Our custom, system, ethics, situations are different, varies in Pakistan. We have to come up the solution according to the needs and requirement of this country. And unless and until we do that, all these money, all these investment and efforts are going to be, God forbid, a futile effort. So with this, I will stop myself here. I feel a responsibility to communicate things, don't mince my word, and communicate things in a right manner. What I'm saying, we mean it. The federal government of Pakistan is working in these lines. I want to see our alignments should not be contradicting each other. It should be complementing each other. I want to walk my talk. Whatever I'm saying is not just the talk. All our plannings, all our efforts, we are talking and executing within the boundaries of all these lines, what I'm drawing in front of you. I'm requesting this August gathering, this forum, since you are here to review. So in your review, this should be a paramount importance. The why there is a reluctancy in the hearts and mind of the people of why are not there? They are pulling us. Why we have to push? God has given a sense, even in animals, to procure, to secure, to protect their children. You can't even touch a cat's, the baby. I mean, they will come and they'll snatch you. How come a human being is so ready that to refuse you, but at the end of the day, God forbid, put and their child in a cancer, in a polio, in an other disease, and then come to hospital and you are waiting there to receive them? How could this happen? So this must address, at this forum. We must find a solution. And don't worry about the timings and things and all. I expect that you come up up with something which is beyond my imagination, which I could not even have thought of. I'm giving you my problem. I'm sharing my problem. I'm sharing these thoughts. I want this forum to review and come up with a solution which should have a wow factor, that everybody would say, oh wow, this is the thing which we are talking about. So these are the things which is important, for a forum which is the review forum, to review this issue and know where you'll have this opportunity